Well, thank you so much, Tony, for the kind introduction, and thank you also for the opportunity just to speak with everybody this morning. And I'm actually going to, it's quite a simple presentation that I'm going to talk about, and it's really about the idea of co-designing mental health services between clinicians and researchers and experts with lived experience and advocacy groups, because I'm going to talk about this experience that we had in Ireland. And I see also that Marguerite Hughes is on the call, so she might also like to talk a little bit about it from her perspective after I've finished presenting. But I was really I'm just going to start just with some disclosures. So as Tony said, I'm working now at the Hospital for Sick Children, and this work was work that was done in collaboration with the Prader-Willi Syndrome Association of Ireland when I was Professor of Child Psychiatry in Trinity College Dublin and working as a child psychiatrist in the health service. And in the last year, I've provided non-compensated scientific advice to a drug company who are developing a new therapy for autism, and none of my talk is going to be related to that. So we circulated the learning objectives. So we hope that at the end people should have a little bit more of an understanding of how we went about doing a gaps analysis of service provision jointly between clinical experts, researchers and advocacy in Ireland. So using co-design and co-creation. I'll talk a little bit about some of our findings around behavioural, emotional and psychiatric needs, and I'll also talk about some of the other needs that we highlighted and talk about service needs in the round, and how that has been helping us a little bit to think about the development of an integrated approach to care. So I'm just going to start off really with this gaps analysis that we did jointly with the Prader-Willi Syndrome Association of Ireland. So at Trinity, my research team is called the Autism and Neurodevelopmental Disorders Research Group. And I had come to know the Prader-Willi Syndrome Association of Ireland over the years through some clinical research projects that we had done in Prader-Willi Syndrome. And they very kindly approached us to ask us, would we help them with a piece of research that they wanted to do, because at the time it was born out of a desire that we had to set up some more kind of comprehensive mapping of services related to autism. And Marguerite and others had given us a lot of input into the design of the survey, and they thought maybe we could actually do this specifically for Prader-Willi syndrome, and it would be really helpful for our community to understand some of the gaps. So it was a collaborative project with the Prader-Willi Syndrome Association of Ireland, or PWSAI, our neurodevelopmental research group, and Professor Edna Roach, who is the expert in Prader-Willi syndrome in Ireland at the National Children's Hospital at Tala, or now Children's Health Ireland at Tala. And of course, we know that PWS is a complex genetic condition with both developmental, physical and psychological symptoms. And so we wanted to kind of assess and characterize the needs of individuals with PWS and their families to inform service development. So that was the goal of our project. And we worked just before I go on to sort of talk a little bit of the outcomes of the survey, we worked really, really hard with PWSAI to co-design the survey. And this is something that is becoming increasingly important in terms of doing impactful clinical research, is to really work with your community to understand what are the questions that are important to the community. And that might sound really obvious, but researchers don't do that, to the extent that they should do. So this really involved us developing a survey, piloting it through PWSAI, and taking lots and lots of feedback from the experts, both the professional experts and then the lived experience experts, to come up with a survey that probably best reflected the needs of the community. So we then implemented the survey through the PWSAI and the clinic in Children's Hospital Ireland. It was a cross-sectional survey that we had co-designed, as I said, and we had 6 main areas that we focused on in the survey. So early life and development, physical health, mental health and behaviour, education and employment, respite and social supports, and finally the impact on the family and the individual. And we had, so of course, as you know, Prader-Willi syndrome is a relatively rare condition. We think in Ireland, I think the estimates that PWSAI say is around, there may be around 100 individuals with about 5 to 6 new diagnoses, I think, each year. So in our survey, we recruited 61 participants, which was about 60% of the individuals who were registered with PWSAI, so fairly representative. It was comprised of children and adults ranging in age from 11 months to 52 years, slightly higher representation of females compared to males. And in terms of the subtypes, we had 43% had deletion subtypes, 26% had maternal UPD, 28% were unsure and didn't have access to their genetic diagnosis, and 3% had imprinting center defect. So just some of the results. So we really learned that early life challenges were prominent for individuals, and that many of the children had a mean stay of 26 days in the neonatal intensive care unit, with 57% of course needing nasogastric feeding. One thing that had changed over time, it was a cross-sectional survey, but we saw differences between the younger individuals and the older individuals in terms of the length of time to diagnosis, probably reflecting better genetic diagnosis and improved recognition. So younger individuals, for example, I think were getting a diagnosis within a matter of weeks, whereas I think for older individuals, it had taken a number of months for them to get their diagnosis. More critically, in terms of how you develop services, the multidisciplinary needs of individuals was really flagged through the survey. So obesity was obviously a significant physical health finding, and this was more prominent in the adult group because they had reduced access to growth hormone therapy. And I think that there was more proactive work around prevention by the time the younger children were probably coming on stream and getting access to services. Notwithstanding that, we also saw that growth hormone treatment was delayed for younger people because of challenges in accessing critical medical investigations, and particularly sleep studies, which are done before the individual will get growth hormone. And we recognized when we looked at different, so we broke the participants into different age groups so that we could see the different kinds of services that they needed across the lifespan. And we saw that they had highly complex needs requiring access to multiple specialists through all the stages of their life, but that it varied. So in the infants, for example, they needed obviously the pediatric endocrinology was critical, pediatrics, and the dentist and respiratory specialists and ophthalmologists. So that this was all very important in this age group. In the school age children, orthopedics and gastroenterology was reported as being a high area of need, and psychiatry was beginning to come in. So school age here probably represents the primary school age children. In adolescents, we saw a high need for psychiatry and orthopedics, and in adults for psychiatry. Now, things like pediatric endocrinology are required across the lifespan, but we really saw increases in needs for some of these other medical specialties as people in the different age groups. So I think speaking to some of the changing needs over time, and from a mental health perspective, also speaking to the increasing need for specialist psychiatry and behavioral support services. In terms of developmental needs, many of the individuals have mild intellectual disability and a smaller proportion of moderate intellectual disability, but there was probably a disproportionate reduction in their adaptive functioning, so their ability to do things for themselves, so just practical life skills. And there were needs in all areas of self-care, but even 40% of adults were needing help with toileting, showering, and toothbrushing, which I think you would expect that many people should be able to acquire if they have a mild intellectual disability, for example. Over 50% were still needing help with some dressing, and the rates are even higher in the teen years. So again, it really, I suppose, speaks to needs maybe around occupational therapy and other other areas to support their activities of daily living. So the mental health diagnoses we're reporting here in the over 12s because they were more common over 12 and less likely for the under 12s to have had mental health diagnoses. And what you will see is that there were high rates of individuals who had any diagnosis. Depression was particularly elevated, and as was anxiety disorder, but we see, and obviously psychosis. And in this study, we saw some overrepresentation of diagnoses depending on the genetic subtype. But I think that you know, first of all, I'm just showing you qualitative kind of descriptive data from a single group, so it's not really easy from this to say how this compares to other individuals. But I just wanted to show you the importance of this compared to individuals who have intellectual disability who don't have Prader-Willi syndrome. So this goes back a number of years to work that we did in Ireland with the Prader-Willi community in relation to mental health diagnosis, where we compared a group with Prader-Willi syndrome with a control group who are matched for age, IQ, and gender. So here our control group are also people with intellectual disabilities. And what you will see here is that we really see an elevation in the number of individuals with Prader-Willi syndrome who have affective problems compared to the control group, and somatic problems as well. So definitely there are some specific areas of mental health that are specific to Prader-Willi syndrome, where people have a greater degree of need from a mental health perspective. Now, this was done using a measure called the Child Behaviour Checklist, which isn't a very accurate measure for psychosis, so we don't have data from that time in relation to diagnosis. I also mentioned that we wanted to look at impact on the family and the individual, and we really saw that there were very significant emotional and physical impacts and financial impacts and impacts on siblings in the respondents to our survey. So for example, I think, you know, financial impacts are often understated for people and families where individuals have an intellectual disability or a developmental disability. But we saw very high rates, I think it was in the order of 40 to 50% of individuals where the one parent had reduced their work or given up work to be a full-time carer at home. So that has a very significant impact on people's ability to earn a living and on their income. And I have to say that we've looked at this also in other populations like individuals with autism, and we see a similar pattern. So really a disproportionate impact on the family's ability to have an income. In terms of education and employment, many of the young people attended mainstream school, but then transitioned to special ed settings. And I think probably, I can see I'm running out of time, so I need to probably wrap now. But I think one of the main things that was concerning from this survey was that many of the adults didn't have meaningful kind of employment. And they also had very limited access to residential and respite care that were specific for individuals with Prader-Willi syndrome, which was really problematic in terms of them being managed appropriately in those environments. And Marguerite can probably speak to this, but one of the outcomes of this survey was that PWSAI were able to lobby with the Ministry for Health to get resources to establish specialist residential care services. And Marguerite knows much more about that than me. As I mentioned, we saw significant impacts on families, but I'm just going to move on to summary and conclusions. So this was a comprehensive and representative survey that really gave us a map of where services were at in Ireland. We saw positive advances in medical care with less morbidity, but ongoing high rates of obesity and critical gaps in access to physical health services and mental health and behaviour services, which increased over the lifetime. And we didn't see educational attainments being matched by paid employment in individuals, and a lot of caregiver burden and negative impacts on family functioning. And as key recommendations were to develop specialist multidisciplinary care in Ireland with expertise in dietary management and behaviour support, And recommendations were also made about establishing mental health teams for individuals, but this has not been realised to date. The PWS specific residential care has been realised to some degree, but I think some work needs to happen in relation to respite care, and also emphasising the importance of co-design and person-centred services.